Welcome back to Biomedcast. Today's episode is going to take us deep into the fascinating world of forensic anthropology.
That's right. We'll be exploring how bones can reveal incredible clues about a person's life, death, and even like the mysteries that follow. The title of today's episode is Written in Bone: The Science of Forensic Anthropology.
And we are so honored to have a very special guest, Dr. Samira, and a senior lecturer in the Department of Pathology, School of Medicine at IMU. Let's welcome him to the show. Yes.
Thank you. Thank you very much.
Can you start telling our listeners a bit about yourself, your background, and how you first got into forensic anthropology?
Yes, sure. So, my background actually, so I'm a forensic pathologist. And a forensic pathologist is someone who's coming through a medical pathway and then taking up pathology and especially forensic pathology. My education and also my postgraduate education was entirely in Sri Lanka. And then it's only for the last 2.5, 3 years that I've been here in Malaysia teaching. So pretty much most of my experience has been in Sri Lanka, and of course I've also worked a little bit in Australia. But essentially, it's forensic pathology. And in Sri Lanka, it's there is no separate discipline for forensic anthropology.
Mm.
So it's the forensic pathologists themselves who actually deal with cases related to skeletal remains, and that's what forensic anthropology is about. So I had a interest in that area, and so I did a bit more work on forensic anthropological cases and so on.
I see. So to set the scene, and what exactly is forensic
Okay,
anthropology
anthropology,
and how does it differ from
forensic
forensic
pathology. All right.
pathology?
Okay. So as I said, so forensic anthropology is considered a separate subspecialty of this broader science of forensic. So within forensic, you have forensic pathology, you have forensic anthropology, forensic toxicology, and so on. So, for example, toxicology is understandable. So it's the study of poisons and
Mm.
things. Pathology is mainly the study of especially cases of deaths
Yes.
that happen under unnatural circumstances or sudden unexpected circumstances where there's an investigation into the death to try and identify what the cause of death was, what was the way that this person died, and so on. Now, picture a scenario where there is a death and the death was not discovered until very late,
Mm.
where the body has decomposed to an extent where it is skeletonized.
I see.
So then the elements of forensic pathology itself is not enough. So you need a separate discipline, which is anthropology, forensic anthropology, which comes in to again investigate um, the depth and the remains,
Mhm.
but obviously with the limitations that you can't do it in the same way that you do forensic pathology, simply because there is no longer any soft tissues or the rest of the body is not available. So it's only the bones.
So, in practice, what kind of situation usually call for forensics anthropologists, or when do police or investigators reach out to someone like you?
Yeah. So one is, of course, when the remains are decomposed to an extent that a forensic pathologist alone cannot provide the necessary expertise. So, obviously, when the remains are so decomposed. But you also have special scenarios, and this is where most of the forensic anthropology has been utilized worldwide. And that is in situations of, say, mass burials.
Mm.
So, for example, you'd have heard that there have been so many conflicts in various places in the world, like, say, for example, Bosnia or Yugoslavia or African countries and so on. South
Yeah.
America, for example. So, where people have been, there have been so many forced disappearances and mass executions and so on. And people are just, sort of killed and buried
Mhm.
in mass scales.
Yes.
So later on, sometimes these graves
Mm.
are found,
Okay.
and you have all of these skeletonized bodies
Mm.
in these mass graves. but nobody knows who they are.
Mm.
But of course, you also have a whole heap of people who've lost their family members or so on, or who believe that their family members have been abducted by these organizations and then killed. So they would want to know if their loved one was in that grave.
Yes.
So that's one of the main inputs of forensic anthropology, which is referred to as identification.
Okay.
So of course, sometimes we are unable to, in a situation like this, we are unable to say what actually killed the person, but we may be able to at least find out who this person is.
Nice.
So
Yes.
yes, so based on certain things, we would try um, to say whether this particular set of remains belongs to X, Y, or Z. So that's one of the main inputs of forensic anthropology. And that's where I would say that the biggest expansion of this science has also happened because of this.
So now let's talk about the bones themselves. So from skeletal remains, what kind of information can you uncover?
Um, a lot. Um, so identification, as I said, would be primarily the main thing. But of course, not every bone is useful for that. There are certain bones which are more helpful than others. And of course, the skull is certainly one.
Mhm.
So we generally start off this identification by first trying to determine what the sex of these bones are.
Yeah.
So, for example, I've got two skulls here. You can probably just make a guess as to which you think
Mhm.
is the male and the female. I brought one male and one female
I think that one is the female one because it's small.
because it's smaller, is it?
Yes.
Well, that's exactly one of the things. So that's where appearances can be really deceiving. In fact, I brought this also to kind of hoping that you would make that assumption because this is actually the male.
Oh,
Okay.
So, just again, just to point out, so some of the features, for example, like the way the bones are structured, the shapes of some of these areas, like for example, the eyebrow,
Mm.
the angle of these nose, and so on, you see that there's certain differences, the way that the bones and the shapes of the skulls are structured. So you see here, this one's, for example, quite curved
Mm.
compared to this one, which is very acute and sharp, and a very thicker sort of eyebrow compared to this.
Yes.
So usually, female skulls have a smoother, rounder
Mm.
contour than the male skulls, which generally relates to their muscle bulk and so on. And so through that, you have these changes that that are seen in the morphology of the skulls.
Mhm.
So the size itself is not a good indicator because you can have females who are
Mm.
sometimes bigger than males. So there are other features that we look at. So sex is one of them, and obviously more than the skull, the best bone to use for sex determination is of course the pelvic bone, the hip, which basically the reason being um, it's females only who get pregnant
Mm.
and who give birth. So it's the hip bones that are structured for birth. So we use certain anatomical changes, or we look at them, and based on that, we try to determine first whether this is
Mm.
a male or a female. Then we can actually tell things like, okay, from there, moving on, we can look at what's the possible age of this person at the time of death. Was this a young person? Was this
Mm.
an elderly person? So again, this pelvic bone is very useful for that. There are certain features which we look at in these areas, which tell us, okay, do we think this is a person who's in their 20s, in their 40s, in their 60s, and so on. So that's age.
Mhm.
We can also talk about ancestry. And ancestry is becoming less important nowadays because there's so much of global movement and um, inter-ethnic marriages and so on. But uh, essentially, the world, the human population, is divided into four ancestral populations.
Mm.
So you have the European ancestral population, you have the Asian population, and you have the African population, and you have what is called um, the Pacific Islands. So, for example, the Maori around New Zealand, Papua New Guinea, Maori, the Red Indians, so they are the Pacific Islands, which is a small population. The Asian ancestral group is really those coming from China, Japan, Korea, and so on. So even though I'm from Sri Lanka, which is part of Asia, from an ancestral perspective, I don't belong to Asia. I'm actually European.
Oh, wait, what?
Because the ancestral evolution that's happened. So if you remember your history,
Uh,
um, the civilizations, you have the Huanghe civilization, which
let's go.
transforms or grows into the East Asian countries. The Mesopotamian, the Babylonian civilization, part of it goes into Europe, and part of it goes into the South Asian, West Asian, so Afghanistan, Pakistan, India, and so on. So essentially, Sri Lanka is a part of that. So therefore, we are really more aligned with the European population than the Asian population. So those features are actually seen in the skulls. And so we can actually tell about the ancestral group, whether we are talking about someone who's likely to be from China, Japan, that region, or whether we are talking about somebody who's likely to be from African region or the European population. So ancestral thing. So likewise, we can actually identify which broad group these people belong to. So that's the first part in the identification.
Is there any other like infant baby they can they determine their age?
Yeah.
Some
Yeah,
you've
so
encountered before.
correct. Yeah. So of course, one of the best things to determine age would be teeth,
The
because we know that teeth change as we go. We start off with milk teeth, and then our teeth start erupting at certain ages. So based on which teeth are erupted, we can actually identify what sort of age group the person is in. And even if it's a complete adult, um, based on the wear and tear of the teeth, you can still say whether it is an older adult or uh, middle-aged adult or so on. But of course, that's less reliable than the early phases. So these are some of the things. Of course, there are other things which tell us specifically whether this is uh, a person. So because the ones that I mentioned earlier, they only put you into a broad group. So you can kind of say whether this person is a female who's around 40 years of age and is likely to be from, say, a European um, ancestral population. You can also tell the possible height
what's your
of the person. So whether it's whatever, 150 meters, 160 meters or so from the length of the femur, because the femur bone is like the main bone that actually um, contributes to your height. So that's one thing. But it still won't help you to say exactly whether this is Mr. So and so, who is someone's brother or so on. That requires more specific identification markers, which include things like, again, dentition.
oh,
So you can actually still say, yes, I think this is exactly this person, especially from things like by looking at the dental pattern. And if you compare that with any dental records or anything like that that particular person had while he was alive, so then you can say, yes, this is that person.
but there should be like any other people that they have the same features, isn't it?
It's very unlikely for
Some
yes, to have the same dental pattern. Let's say if a person's been to a dentist and undergone certain treatment, let's say for example a cavity filling, or any treatment in terms of wiring or even like extractions. And even the shape of the teeth and the way they are structured, the way they are sort of placed in the gums, it's very unique to each person. So it's like a fingerprint.
Yes.
So if you have that, records of the treatment and so on before death, and you compare with what you see after death,
It
it's
should be
almost a
easier
hundred,
to
yeah, you can actually match it.
and then like what are some of the key methods to say like you used to do that uh, do that investigation, like find out those clues,
The identification and so on, is it?
the key methods.
Yeah, so there are different methods. So the one that I mentioned was actually what we refer to as anthropological morphological methods. Morphological in the sense we are looking at the morphology of the bones, and based on that we are making certain inferences. Right? So that's a morphological method. But you can also use anthropometric methods where you're using definite like measurements.
Mm.
So, for example, um, this is called the head of the femur,
Mhm.
and the diameter of this head of the femur is very specific. So, for example, normally in a male, the diameter um, of this femur should be above 44 or something, 44 millimeters if I remember correctly, something like 44. Whereas in a female, it would be less than 42 or something like that, right? So there are certain specific guidelines that we use. So those are more anthropometric methods. But yeah, most commonly we would use the morphological
Morphology is just based on
appearance
appearance.
and the differences between the sex and age and so on. Those are the more common methods. You can also obviously use DNA, but again, the problem is it all depends on uh, how good a quality of DNA you can extract from the bones. Because sometimes you can, I would say most times you can't. You can't get quality DNA from a extremely skeletonized specimen. So then that test becomes
Usually we
basically
can't like simply extract the DNA from bones.
not always.
Can we extract from the skin? Like,
Yeah,
if
yeah,
there
yeah,
are
yeah.
remains,
If you have soft tissues, it's much easier,
but the bone is like much harder.
much harder. It depends. You need more sophisticated methods, and not all labs can also extract DNA from bones,
Does it require like specific techniques? Yes.
which is sometimes costly. So the information that you can get with that huge cost,
Mm.
you might as well just get it using morphological methods, which is probably going to be more cost effective and easy.
And how long does it usually take to analyze like a bone person?
Oh, that I would say it varies depending on the case, because it requires a lot of examination, documentation, comparison. Um, it also depends on how many people are available to work on the case. So if it's just one person doing everything, it'll take. So I mean, cases that I've had sometimes have gone on for months because
Months.
I have to like take, measure individually each of these and then look at each component. There is also a whole process of like documenting, inventorying these bones. And sometimes, now these are all nice and clean.
Mm.
But when we get remains, they are not always nice and clean.
Yeah.
They're kind of messy. There's bits and pieces of tissue, um, hanging out of them. So you have to first clean them,
Clean first.
which is also a long process. So you have to, sometimes you have to like subject them to sort of various like processes like sort of boiling them in a kind of an acid bath to get rid of the soft tissues. Then you dry them. So all of that takes a long time.
Like for your team, right? If you meet like the crime scenes, usually you guys should have did the examination faster, right? And usually how long it would be for the examination?
Um,
Is it within a week or should be that
well, some of them actually, as I said, so go on for months and
on
few years. It also then you also require information to be given to you
uh,
about a missing person for you to make a proper call because that say for example you can get a remains and you can say okay this remains is likely to be
mm,
a 50-year-old man or whatever,
uh,
but unless someone comes up and says okay I've had a father or a brother who was 50 years old and he went missing,
mm,
could I know if this particular remains belongs to that person? Unless someone comes and gives you that information, we can't exactly say who it is.
So
So
get some information
you
about
have to
them.
get some information from either the police or the missing people or the survivors of or relatives of this person to actually be able to close a case.
It's interesting.
So sometimes the bodies, like for example, like there was a tsunami in 2004, which affected a large population in Sri Lanka. A lot of bodies were found much later,
Oh.
unidentified bodies, and nobody knew who they were. And these were extremely decomposed bodies. And some of those bodies are still in certain labs because nobody's come forward to claim them.
Oh, it should be a big process.
So some of them can just, so it's 2004 and they're still in the lab.
Mm. Every science has its boundaries, right?
Yeah.
And what are some of the limitations of this forensic anthropology? And then, like for instance, can bones reveal anything about soft tissue injuries or even emotional states?
Um, so no. So the short answer is no, because um, if the injuries or trauma has only happened to the soft tissues, it's very unlikely that we can find um, anything um, to suggest that this person has had that soft tissue injury. In certain situations, for example, inside the skull, if there is a bleed, if there's a bleed inside the skull, it is possible for that bleed to stain the inner surface of the skull. And so even after the brain has decomposed, we might still see the stain on the inner aspect. So that might give us a clue to say that, oh yes, there's been a bleed. But apart from that, usually, unless there is some continuation of the trauma onto the bones, it'll be very difficult. So yes, that is what I would say is the biggest drawback in forensic anthropology, which is not a fault of forensic anthropology, obviously. It's just that you don't have the soft tissues, yeah, to be able to say. But if there is trauma to the bones, then yes, forensic anthropology can help in determining what caused the trauma, whether it was a blunt force injury, a sharp force injury, whether it was a gunshot injury, blast, and so on. So it's still possible to do that trauma analysis.
So, are there situations like where bones alone don't provide enough the evidence to draw strong conclusion, like where they reveal so little that you are left wondering, like how do like
Yeah, so certainly, and even just from my experience, most of the cases that we get, we can provide only very little information. Um, so, for example, we might only be able to say, okay, we think that this person is a male, and about this age, but beyond that, we can't say anything. Again, depending on what bones are available. So, for example, we cannot comment about the stature of the person if the femur bone is not there. And let's say we don't have the full femur bone, but the femur bone is only like you only get half of it because it's broken or because animals have chewed on it or whatever. So then again, our calculations may not be accurate. Um, as I said, trauma,
There's so
well,
many
it's only
factors
so many
affecting this.
factors. Sometimes it's not easy to differentiate trauma from, say, animal attacks, as in scavenging attacks, um, with actual trauma in the person's life. So it's sometimes it can be a bit difficult, right? But to the experienced eye, yeah, you can actually distinguish them, but it's not easy. So yeah, definitely lots of drawbacks, and it's limited. The amount of input that can be given is limited, but that's the only science available to even give that information.
I can imagine that must be very frustrating, like
Sometimes, yes.
limitations. So, like when a body is reduced to just bones, and how you figure out like the person was how long they have been gone.
Oh, you mean the time since then? Yeah. So that it's related to forensic anthropology, but it's actually a slightly different science called forensic taphonomy. So forensic taphonomy is actually the science of studying the changes that happen to biological material with time. So bones included, when the person's, just died, as opposed to when the bones being exposed to weather and environmental conditions and so on, there are certain changes that happen. Color, the consistency, the brittle nature of the bone, and so on. So all of that gives us an idea as to how long this bone's been lying out. But of course, again, the nature of the environment that it is in can either accelerate that process or can reduce it. So it can be confusing. For example, you might find a body that's lying in a fairly acidic soil, versus a body that's lying in a normal soil. So we keep them for the same duration, right? But you'll find that the one on the acidic soil's got more brittle and looks like it's been dead for much longer than the other one.
Yeah.
But that's because of the environmental conditions. So you have to know exactly what the conditions were, um, before you come to a conclusion based on the evidence.
Before you come to conclusion, right, you said there's many factors that affecting this kind of investigation or examination. And then you guys really go through each one by one of the analyses.
Yeah.
Is it
Yes. So
just have a big direction of what it would be that will affect this the remains?
we have to actually get an idea as much as possible about the factors. So if, say, for example, the police bring me a set of bones,
Mm.
um, and I haven't seen where the bones were lying or where the bones were found,
Mm.
then my interpretation would be limited. So I would request the police either to take me to the scene
Mhm.
and show me the scene, or I would ask the police to give me that information. The people who actually did the scene visit and who collected the bones. I would want that information from them if they can't take me there.
Mhm.
Because yeah, those are important factors that I need to know before I can give my report.
So, what are some of the toughest types of cases we have faced before? Like, for example, dealing with bird remains, fragmented bones, or identifying the children bones.
Yeah, so pretty much all of those cases, yes. Um, Again, when it's a burnt remain, the complexity is much more because again, the remains are burnt, and
Yeah.
therefore when
It's
when they're
stored.
subject to heat, yeah, even the morphologies change.
Mm.
So, we need that morphology to make our conclusion. So now it's burnt, it's very difficult. We've had cases of, as I said, the mass burials. So one problem with the mass burials is then, so because essentially what happens is in these situations, so there's a pit that is basically, excavated, and then you have all the bodies just dumped into that, right? So when the bodies start to decompose,
Mm.
then these bones, they also grow loose,
Oh.
and the bones just start mixing with each other. So then it's very difficult to figure out, okay, where are the bones of this person, where are the bones of this person? So you can't figure out whose hand, whose leg, and so forth. Um, so in mass burials, therefore, there's another science that comes in
Mm.
to support this, and that is called forensic archaeology.
Archaeology. Oh.
So again, the principle is if you do find a mass grave, you do not do anything.
Mhm.
You just leave it there and get the forensic archaeologists to come in and start just bit by bit. You might have seen in movies how they unearth like dinosaur bones and so on, how they like, very carefully brush the soil aside and then, start unearthing.
Antique stuff.
Yes, exactly. So you do the same thing here. And you try to, like, as much as possible, try to identify, okay, which are the bones for this person, which are the bones for this person. You take photographs of it, you document it. And it's only afterwards that you take the bones out of
Mm.
the pit.
Take a go and then take it to the lab and take it.
Yeah.
Experiment.
So if you do it that way, then at least you have a chance of, say, for example, if a body has been dumped into the pit with clothing,
Mm.
then at least because the bones will still be inside the clothing, right?
Yeah.
So you can at
Stick.
least they won't stick, but at
Uh,
least you can judge the position. So for example, this femur would still be inside the pants. For example. So you know that okay, this femur, the rest of the bones inside that pants
mm.
is one person.
Oh, like that. Okay.
Yeah, if you just take it out,
Mm-hmm.
then the pants come separately and the bones come separately, you will not know okay which was of that.
Mm. That sucks. Actually, if the pants with the same color at the heel, then you can definitely
Yes, so at
know
least you know,
it's
okay,
from the
it's
same
part of the
person.
same person and so on.
Mm.
So that all of that is forensic archaeology. So that they are very much tied. Forensic archaeology, forensic anthropology, and also forensic
Mm.
odontology. That's the understanding of the teeth.
That's really impressive. Yeah,
So three of them
never
are kind
heard
of
that
there.
before. Mm.
So like technology is changing so much in every field. So how have tools like 3D imaging, CT scans, or even AI impacted the way you do skeletal analysis?
Compared to a lot of the other forensic sciences, I would say that the use of technology is much less in forensic anthropology. Um, of course, technology comes in a different way. So, for example, like now, if I want to get a second opinion of this bone
Mm.
um, from, say, an anthropologist who's living in Canada, either that person has to come here or I have to take this bone to Canada before, right? But now you can, of course, do a 3D scan of this, and depending on the quality of the resolution of the 3D scanning, I can just send that digital image
Mm.
to my colleague in Canada and ask for his opinion. So he will get pretty much the exact same replica of this, and so that facilitates that kind of interaction. Um, when I'm presenting to courts, I can use the 3D image instead of having to take this particular bone, right? So these are little things that help or facilitate the investigation process. Um, but otherwise, I would say there is very little actual uh, advancement in the investigation, simply from technological inputs. CT scans, yes. Again, CT scans are very useful because, for example, I don't have to cut open the skull to actually look and see what's inside. I can just scan this and get an idea. But again, I would still need to look at the thing at some point.
Mm.
So, yeah, bit limited. How
To anthropology forensics, they're still using any AI tools to analyze it.
not that I know
Yes.
much of.
Based on that.
As far as I know, I don't know of any AI tools that are actually in place at the moment.
Mhm.
It's possible that there are AI tools in certain image recognition software. Like say, for example, you can have. So, for example, if this is 3D scanned and you put it into a software, there's a possibility of that particular image like detecting the morphological or the metric elements
Mhm.
within this and matching with another 3D image and saying, "Ah, okay, yes, I think this fits that kind of thing." Um, so for example, if you have a 3D scan, if this particular person has had a 3D scan, a CT scan, sorry, a CT scan done while he was alive, right?
Uh-huh.
And then you do a scan of this,
Mm.
then you can use the AI to okay, scan and then say, ah, yes, it's this particular person CT scan and this is has got a match,
Yeah.
that kind of thing is possible,
Possible.
but I still don't know of any
Available.
of actual, yeah, of that actually being used. Also, it's important in forensics. Just because there is a tool available, it doesn't mean that you can use it in a court case because courts work differently.
Mm.
So the courts have to accept this particular AI tool, and they still value the older methods than any new tool coming in. You really have to justify why that new tool is used and that the new tool is reliable enough to make a conviction or a decision in a court case.
But do you think like this kind of technologies will ever replace this kind of traditional methods, anthropological methods, or they
Well, look,
just
I'm from the older generation anyway,
uh,
so
because we think like the AI will be the future?
I mean, I'm seeing certain areas that are developing. It's difficult to predict exactly. I don't see I don't see AI being the sole determinant of an investigation. You know, it's I still feel that it would very much be a human thing. But as I said, so you could have new tools, new software to help the investigator to come to a conclusion faster, or or make it a little bit more broader, interactive, that kind of thing. But yeah, because a lot of these are morphological interpretations based on a person's experience, based on a person's understanding, and so on. So I feel that there's a lot of human factor that comes in this.
Sounds really interesting actually.
But yeah, again,
Uh,
from the older generation that is used to
who knows?
non-AI
Like it's the
based, yeah,
future.
yeah,
We wouldn't know.
who knows?
For listeners who might be interested in this career, the forensic anthropologist, what kind of training or background is needed to become this career? What would you
The
recommend?
main discipline is anatomy.
Anatomy. Ah,
This is
understandable.
all about bone
Uh-huh.
anatomy, and bone anatomy at its, how should I say, at its, the finest, deepest level. Even
Very
medical
deep.
students don't have the
That deep.
level of knowledge, of anatomy knowledge
Mm.
needed to be an anthropologist. So, I mean, it's like, so I mean, if you have this full femur, anybody knows, okay, this is a human femur.
Yeah.
I mean, any person who's done, science and anatomy sees it. But let's say you only have this part,
Okay.
right? Just this section,
Mm.
because that's what you're going to get in a skeletal actual remains. You're not going to get a nice full femur like this. You're just going to get parts of it because these are going to be subjected to wear and tear, scavenging, and all this sort of things, right? So then, let's say you just have only this part, right? And if then a person's asked, okay, is this a human femur? Is this a dog's femur? Is this a horse's femur? It's a completely different ballgame. So an anthropologist would need to tell you that. Um, and
Other than anatomy, and still
yeah, so anatomy is definitely the number one. The next I would say is bone pathology.
on the
So having an understanding of what could happen to bones, even identifying certain diseases in bones. We know that the bone is like, one, especially in older people, is one of the systems that has a lot of diseases. You have arthritis, various other degenerative conditions that can happen, osteoporosis, and so on. So you have to be able to recognize that in a bone structure because that's part of the identification also.
Mm.
So, for example, you could tell about a person and you could say, okay, this person's got more wear and tear or more osteophytes in the pelvic bone, which suggests that this person may have had hip-arthritis or some kind of osteoarthritic disease. Might have been a person who complained regularly of back pain. We can tell if a person's had children from changes that happen on the pelvic bone. So that recognition requires some pathological input.
So the person who interested in this career should be like interested in every single part of the body. Can I say like that?
Um, Anatomy, definitely. Anatomy, definitely. Pathology can be a little bit. I mean, you can work with a pathologist and then come up with conclusions. So you don't have to have a pathology background as much as you need anatomy. But anatomy, yes, definitely.
I see.
And lastly, what's one thing you hope our listeners take away about forensics anthropology and its role in modern forensic science?
Um, this is not a field which is, how should I say, um, which is as fast paced as a lot of the other, like say, crime scene investigation and so on. That's a lot more fast paced, and you have to rush to the scene, you have to do your stuff and all. This is a more lab based um, discipline.
Mm.
As I said, there's a big connect between forensic anthropology and forensic archaeology. So if you're coming to this, you need to be prepared sometimes. So if you might be sent out to some very obscure location where a mass grave is found, you know, and you have to sit there for days,
Mm.
you know, carefully trying to, bring out the bones that are there, and you to be able to like work in very, very poor minimum facilities because you won't have, nice hotels or whatever in those areas. So you might have to just sleep in a tent or whatever or some shack. And then it'll take obviously quite a lot of days to complete an extraction of bones from a mass grave. You have to be able to handle decomposed remains. Because as I said, so this is the end product. This is not, this is very rarely the product that is sent to you.
Mm.
The product that is sent to you is messy, it's smelly,
Yeah, yeah.
so you have to be able to work in an environment like that. So it's 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 an interesting subject and nice to read about,
Hmm.
nice to watch on movies, but to be in a lab and work on it is a completely different
Would you
set
say
of
like
requirements.
it's actually a person who interested in this should have a strong heart, strong mental,
Yeah, I guess. I
because they
mean,
want to manage this.
yeah. So in the
Uh,
sense that yeah, it requires um, it requires you to be able to distance yourself from that emotional aspect that you are dealing with a dead person's remains, and to be scientific. You have to be methodical because, as I said, there's a lot of documentation, inventorying, and so on. It's very rarely about, most of forensic is like that. It's very rarely about being that very clever person who picks up, some obscure clue.
uh,
More than that, it's about that rigorous process of sticking to that protocol of, okay, yeah, you identify things, you document them, you record them, you photograph them one by one. You have to follow certain SOPs. It's a very painstaking stuff. And you should expect a load of, like a pile of files, case records, and so on, which will remain with you until you retire.
it's not- not-
So
mm,
that's forensic, and yeah. So
so much respect, so much respect from me to this kind of career. Okay, so that's the perfect note to end on.
yeah.
And thank you so much, Dr. Samira,
Thank you for
for
having
sharing
me.
your expertise, your stories,
Thank you for
and
having
your
me.
patience with us today. Yeah.
Absolutely. Pleasure. Sure.
And to our listeners, thank you for tuning in into Biomedcast. So if you enjoyed today's episode, be sure to follow us so you don't miss the next one.
And until next time, this has been Written in Bond, the Science of Forensic Anthropology. Take care, and we'll see you in the next episode.